All right, I am so excited today to have Elena Segre, who is a wonderful person I have gotten to know, and she wears many, many different hats as a healthcare provider and a patient. So, if you want to just go ahead and give us a quick introduction, where you live, and what is your relationship to arthritis?
Sure. My name is Elena Segre. I am a cardiology fellow physician. I live in San Antonio, Texas. I am related to inflammatory arthritis because I have it. I have a diagnosis of rheumatoid arthritis plus some others. Um, and that happened about 5 years ago in 2018 was my diagnosis. Yeah, I have it, and I occasionally treat it, although not very much as a cardiologist. It does sort of live in the periphery of what I do. But as an internist, certainly I saw it and evaluated and experienced it.
Yeah. I know you and I've talked about this off off the record about how different it is to be a to have the patient lived experience versus the healthcare provider, doctor experience. Can you share a little bit about your diagnosis story, your diagnosis, quote unquote, I often call it a saga. Um,
Certainly, a
yes.
saga is an
Yeah.
appropriate term. Sure. If you see me looking down, it's just because I wrote it down. I wrote some notes here. Um,
Perfect.
Everything started pretty early. Well, not too early. It started in 2015 for me when I was 24. I was in graduate school. I'm also a clinical exercise physiologist, so I do cardiac and pulmonary rehab before I went to medical school. But sort of right in the middle of graduate school, I woke up one morning and really couldn't move my left arm at all. Nobody really figured it out. The diagnosis I was given after some EMGs with like the painful nerve, like the needles that go in, was
Mhm.
an undifferentiated mononeuritis. They said idiopathic. It's just like something that happens sometimes without a great explanation. And I had a few more episodes of that in graduate school, and it took a couple of months to return to normal function, but I was always able to go back to mostly my previous level of functioning and a few episodes early in medical school. In 2018, I was a third year medical student, and I am also actually I'm active duty military. So I went to the Uniformed Services University of the Health Science, which is a mouthful. That's its abbreviation is USIS. Essentially, it's like your academy or your Air Force Academy or West Point for medical school. So instead of
Oh,
being a scholarship student, like with your HPSP or your ROTC equivalent, I was active duty in school and went to this academy of the medical sciences. They forgot though to send me to officer training before I went to medical school, like I was supposed to.
oh, okay.
They just left my name off the list that Congress approved. So I went halfway through as a third year, and while I was there, I started having some finger pain. We had to
Mhm.
like stand at attention where we'd like make a fist, and it was just like it was
Mhm.
very painful. And I thought I had a stress fracture in my foot, just from marching,
Mhm.
as one does at officer training. So I came home. Thought I was rehabbing a stress fracture, just took it easy, wore a boot for a little bit, and a couple of months in, it just wasn't getting any better. My fingers
Mhm.
were getting really swollen, like they look like true and true sausage fingers, if you hear that, like thrown around for like
Yeah.
psoriatic
Yeah.
arthritis. Like, they looked like sausages.
Yeah.
And I was seen by my primary care, who pretty expeditiously sent me to rheumatology. And then
Mhm.
from there, I had one visit where he tried to tell me that he gave me the fibromyalgia speech, and fibromyalgia is a very real condition that we just don't understand a lot. That a lot of times we say, there's a misconnect between the brain and the
Mhm.
signals. And he was giving me that speech, and I'm like, sir, I respect that, but I don't think the sausage fingers are being caused by that. Um,
Yeah.
so after an ultrasound and some lab tests, it was very clearly like a diagnosis of RA. So the first diagnosis was actually like pretty easy, all things considered. It took me
Mhm.
about 4 months from symptom onset to diagnosis to get something.
And then in retrospect, do you think that that not being able to move your left arm in 2015 was like real early signs that maybe just flared
Uh,
up and went away, or who knows?
so we don't know yet. So
Mhm.
that sort of gets into the next,
Okay. Yeah.
yeah, the vasculitis journey. But so I was on and off different treatments. So I've been on every single class of drugs that you can be on for RA. I've been on at least one of them and either failed them or been unable to tolerate them. So I think I started off with your like standard triple therapy. So Plaquenil, sulfasalazine, and methotrexate. I had horrible side effects from methotrexate. I am so disappointed because it worked so well. And I did the pills and I did the injections, and I would just wake up in the middle of the night vomiting every week, like hours after I injected. I would just like wake up from sleep and vomit a few times.
Awful. I'm so sorry.
So we got rid of that one. I did Humira. I've done Enbrel. I did Orencia after that. And nothing was really like, it was close, but it was not good enough for what they wanted to see. So we just kept cycling and cycling. And that took me all the way through my residency in internal medicine, being on and off those different combinations of medications, and into fellowship. And I got COVID January before I graduated in my residency. So January 2022. And then really started becoming more out of control then. So I had horrible, like a jaw involvement. I have some ear involvement, like the small joints in the ear had synovitis.
Yeah.
So I got that fun little thing. And then just like really bad, like inflamed, hot, just like every sort of disease activity measure you could look at was off the charts. I got switched to Actemra, which worked pretty well, but just not quite well enough. And it's the same story, not quite well enough, not quite well enough. We tried Xeljanz, which was horrible for me. Like, I wish it had worked because it was the pill and it's, you don't have to inject. That's nice. But things were not looking really well. So we eventually decided to try rituximab, which was an adventure. So it is a very long infusion. There are a lot of the other medications can be done in like a monthly infusion, but they're usually 1 or 2 hours. This is like an 8-hour infusion.
Yeah.
And I actually did really well on it, but I can't tolerate it very well. So I had a pretty big infusion reaction. I had really high blood pressures in like the 200s, chest pain, shortness of breath. Like it was just I couldn't get through the infusion. So I took the 2 doses of that and we sort of threw it off because like can't really do a drug that gives you that. And I was actually doing really well. Well, from a joint pain, I was like, wow, this is the best my joints have ever felt, which was great. And then we were in our honeymoon. On our honeymoon, we went to the Maldives, which was truly spectacular, like really a great place. And I thought I'd gotten sunburned, and it was just like March of 2023. And I had this like splotchy sunburn all over my legs. And I'm like, well, gosh, I must have missed a lot of areas. Yeah. And I'm like, that's a pretty weird looking sunburn. And then on the plane back, my legs just like swelled a lot, which, we were lucky enough to buy our flight on points. So we were actually flying business class, which was really nice. So my feet were elevated. I'm like, I didn't think they would swell this much, but they were really fat. And then I started getting this, like what we call a purpuric rash. So just like little busted blood vessels would sort of break out and we like press on them and they don't turn white. So non-blanching purpura. And I emailed my rheumatologist. I'm like, this is kind of weird. Like, what do you think of this? And he's like, well, it looks kind of allergic. We'll try some Benadryl or something. And it just wouldn't go away. And I got it biopsied. And on the biopsy, the dermatologist called me back and says, you have a disease called PAN, which is polyarteritis nodosa. And I was like, what?
Yeah,
vasculitis. So it's a vasculitis. It's a necrotizing small and medium vessel vasculitis, which means that it's like an inflammation in the walls of the blood vessels themselves.
Okay.
So that's what they told me I had. I called my rheumatologist who was following along. He said, no, you actually don't have that. We probably have something similar, but when you have it in the setting of rheumatoid arthritis, it's called rheumatoid vasculitis.
Oh, okay.
So that's where the original diagnosis of rheumatoid vasculitis came from.
Okay.
And it was just at the time some rash. And they got a bunch of labs just to look for other things that the vasculitis can cause. So it can cause kidney problems is a big one. It can cause nerve problems, which is what we may think would happen to the arm. It can cause anywhere there's a blood vessel, it can cause a problem. So it can cause eye problems. It causes all sorts of problems.
Okay. Yeah.
what we decided for me was initially it was just skin. As the sort of the summer went on at that point, my blood pressure started going up like a lot.
Mhm.
At one point I was on like 5 different blood pressure medications and still not the best controlled, which is pretty unusual for like a 33-year-old.
Yeah.
Um, and at that point we had some more labs done and there was maybe some involvement in the kidneys too. So going
Mhm.
back and forth on different medications for the what we thought then or we think now is still some sort of vasculitis. I was on a medication called Imuran or
Oh
azathioprine,
yeah. I
which
took
worked.
that while pregnant. Yeah.
Yep, and
Yeah.
it's safe in pregnancy, which is awesome.
Mhm.
I had some problems tolerating that as well with nausea and vomiting, but we made it.
Mhm.
Eventually, I just got used to it. But I just kept getting these rashes and they would break out all over my body, like all over my legs, arms, and chest. And we just couldn't get, I was on steroids. For the vasculitis, use much higher doses of steroids. So usually for like a rheumatoid arthritis flare, you're sort of looking at like a 20 milligrams as like your
Mhm.
top dose, and you come down for there. For vasculitis, a lot of times they would put me on 80 for a couple of weeks and then titrate down from that. So
Oh
much,
wow.
much higher doses of steroids.
It's a lot.
With a lot, a lot of steroids, and the blood pressure wasn't getting better. So at the end of the year, sort of towards October, everything was just, it was not getting better despite steroids, besides the Imuran, besides all this other stuff that I was on. And my rheumatologist decided that it was probably time to start thinking about a medication called cyclophosphamide. Cyclophosphamide is a chemotherapeutic drug. It has been used. It was one of the first drugs used for rheumatoid arthritis, and it's sort of described as like the nuclear bomb to like end all other immunosuppressants. So it's extremely effective for both vasculitis and arthritis, but it comes at a pretty high price, and that it is a true and true, like we say like methotrexate's a chemo drug, but it's not really used at the chemo doses, right? So it's a little bit different. This is given at like this more or less the same doses as a chemotherapy. So you're looking at a lot of the same side effects. A lot of loss of fertility is a big one. And then risk for future cancers. So risk for bladder cancer and blood cancers. So it's not a drug that people typically just use. You'll use it typically in bad vasculitis or like lupus, where you're looking at like organ involvement. So like lupus nephritis or like lupus cerebritis, where it's like in the blood vessels of the brain. So they do use it, but not that often.
Mhm.
Um, and in preparation for this, they wanted me, I wanted to talk about like cryopreservation or egg
Yeah.
preservation for the fertility, because my husband and I really want to have kids. Um,
Mhm.
and it's much more difficult after you have a cycle of, or a round of couple of rounds of cyclophosphamide.
Mhm.
Um, we were lucky in that the hospital that I work at has reproductive endocrinology. Not all of the military hospitals have it.
Mhm.
So we were seen pretty quickly by them, which was fantastic. And they were actually able to submit a request to the insurance that they cover it,
Nice.
which is great because it's not usually covered, but there's like a very special rule that if you're using it for like, actually the rule says for cancer chemotherapy,
Ah,
then TRICARE will pay for it. Um, didn't have cancer, so we had to sort of ask really nicely, but it was still the chemotherapeutic. So TRICARE actually eventually offered to pay for this, which was
wow.
fantastic. So the caveat to that is it's not TRICARE paying. There's like it's a very weird reimbursement system, so I couldn't get it done at the military facility. It had to be done at a civilian hospital locally,
Okay.
so that they could reimburse, because this like separate pot of money can't be used to pay the military. So we
Uh,
go over there. It takes a while to get an appointment, right? Everything is 1 to 2 months of getting an appointment.
yeah.
And I'm seen by a local hospital's group, and they were like, "Sure, we're happy to help you out. We need to do all these things first." And they found a cyst on my ovary, which was totally benign. Like people get ovarian cysts, they're
Yeah.
part of how the ovaries work, never really bothered me. But they're like, before we start giving you all these hormones, we want to make sure that it's not something to worry about or something that'll grow with the hormones. So they sent me back because they can't actually evaluate that at the civilian hospital. I have to get it done at the military hospital. And I'm trying to get in touch with like gynecology here and get the ultrasounds done. It was just kind of a disaster, like communicating between two healthcare systems.
Yeah.
And in the meantime, I start having another big rash. So at that point, my rheumatologist offers to do a therapy called IVIG, which is IV immunoglobulin. And essentially, it's like, I'm not a rheumatologist, but it's like the immune part from like 1,000 blood donors all pooled into a bottle. You give
Mm-hmm.
it IV, and I think it's supposed to sort of like act as like a temporary immune system to tap things
Yeah.
down. So we
Yeah.
started a couple of rounds of that while we're still waiting to get on the Cytoxan. We try and try and try. I'm trying to push through at this civilian hospital, but it's over the holidays and things are just not moving. And eventually, go
Wait,
ahead.
can I just really quickly ask, because I think people listening are going to wonder, were you working full time
I
during this
was.
time?
Yes.
So
Yeah. I
like,
was working full time.
how were you doing that? Like, how were you managing? Like,
Well, it's kind of a blessing because I work at a hospital. So like
yeah,
all of these appointments, I like go downstairs or like the lab, like
yeah.
go downstairs on my lunch break or something. So in some ways, it's a lot easier.
Yeah.
The other rule is the American Council of Graduate Medical Education, the ACGME, actually mandates that programs must give you time away for medical appointments. So like
Oh, okay,
I
good.
tell them I have something to go to, like no ifs, ands, or buts. They have to cover me. So they
That's
are very good at working with me, and my program's been extremely supportive. But yes, I've not worked full time through this whole thing. But through there, I was absolutely working full time on service.
I just feel
It's
like
busy.
it, I just think it would be so mentally exhausting to be like a functioning cardiologist and then have to manage all your own health. I mean, I think as a patient, sometimes we forget that our doctors, this is a little life lesson in here, I'm interjecting, but our doctors might be battling things we have no idea about as well,
Yeah.
whether it's fertility
Yeah.
related, chronic illness. So anyway, that's my point. But you're in the
Yeah.
middle of telling the
I
story.
was
So
on that, and I was thinking to myself, it was about that time because it was over Christmas that this was all happening. And I was doing our Christmas coverage. I was in our cardiac care unit, so like our sickest patients. And I was working on my blood pressure, changing all that stuff, changing the medications to get on like uh pregnancy friendly medications for during the IVF cycle. And it's always like changing all my medications all over the place. And I woke up one morning, I think it was like Christmas Day or the day after Christmas. My blood pressure was like 70 over 40. And I had to like go into the hospital to like work. And I was like, I don't feel good. And I was joking. I'm like, man, my blood pressure is lower than all of my
then your
patients.
patience. Yeah.
So I sat down during rounds that day, but other than that, we made it out okay.
That's amazing. I mean, that's more power to you. That's a
Yeah,
lot.
it was a lot. But it didn't really seem. I'm pretty used to managing my health because the RA has been going on for a little bit and it sort of rolled up. So it didn't seem like a lot at the time. Like looking back on it, I'm like, well, what was I doing? But like, it
No,
was just,
that's what I
I
do
wake
that
up
all
and
the
go to
time.
work. That's what I
Yeah.
do. Like,
There are times, seasons of my life before starting this podcast and everything, because my
yeah.
health has been pretty, stable-ish in the last 4 or 5 years. But there were some times in the mid 2010s when I look back and I'm like, I do not like, you don't know how difficult it was to function every day until you start feeling better. And then you're like, how did I function through all
Yeah,
that? But
for
you
real.
1
Yeah.
hour at a time, 1 minute at a time, one breath at a time. Yeah.
Yeah. Yeah.
Oh my gosh.
So mid-January after all this, I'm trying to talk to the outside REI department and they're just not responding. I think the
Mhm.
provider was on leave or something. And I wake up one morning, I'm not able to move my left foot. Like just like a complete like drop foot. Doesn't move up, doesn't move down.
Oh, wow.
And I'm
Okay.
like, oh, that's weird. So I emailed my rheumatologist. I'm like, hey, just so you know. He's like, why don't you come in downstairs that same day? So, it was easy because I was already at work. So I just, go
Mm-hmm.
down 2 flights of floors underneath and there he is. He walks me in. He's like, that's mononeuritis, which is, again, what we think maybe happened to the arm. Nobody knows because that was so long ago and I didn't even have RA then. But they said that's probably mononeuritis multiplex, which is essentially like the vasculitis the vessels that feed the nerve are inflamed, so
Okay.
the nerve stops working.
Oh,
Um,
okay.
so they admitted me. I was actually like in scrubs. I like ran some stress tests for the department in the morning, went downstairs and they're like, well, we need to admit you. I was like, are you kidding me? So I was admitted for 6 days, I think.
Oh my gosh. So
For
does
what
it, is it because, is it life threatening or what?
life and limb threatening, yeah.
Oh,
So they
okay.
were this is
Okay.
life, limb, or eyesight, sort of the rule for the emergency room.
Okay.
So that's like considered a major manifestation of a vasculitis. And I had just gotten a bunch of rash too. So they admitted me and we did something called pulse dose steroids,
Mhm.
which is just like stupid high doses of steroids. So it's like I got a gram of solumedrol for 5 days,
Wow.
which is about, I think it's like 650 milligrams of prednisone. It's just like huge doses of prednisone. And
Oh,
so like it does not feel good.
what, what did it feel like?
So if you like feel like you can put people into like psychotic breaks from these. So like I didn't sleep like hardly at all.
Wow.
You can put people into funny heart rhythms with them. I didn't have any of that. It was just like I was like totally jazzed. Like think about the worst like prednisone shakes you ever had and like multiply it by like 100. Like it was miserable.
I
Uh,
get really anxious on like 25 milligrams.
yeah,
Like,
yeah.
so yeah, I
It
can
was
literally can only
horrible.
imagine how
It
you,
was horrible. The
oh,
good news is with an admission, you're really able to coordinate a lot of care. When somebody's inpatient, it's a lot easier to get people to come and see you. So rheumatology was not joking around. They're like, we need to start the Cytoxan, and it doesn't really matter that you haven't done the IVF yet.
mm,
Fortunately, the department at my hospital was able to come up and see me. And even though the military hospitals, we don't run the cycles of IVF that often, there are a couple of cohorts a year. They were about to start their winter cohort and they were actually able to squeeze me in. We ended up paying out of pocket for it. It's at cost when it's at the military. So we paid, I think, $7,000 for the cycle, which is much more discounted than it typically is for a cycle. And they were able to squeeze us right in. So the rheumatologist was willing to wait for that cycle to be completed, not for me to wait and see what was going on at this other hospital,
mm,
but 1 to 2 weeks, they're like, okay, we think we can give you the steroids. And as long as in like 2 to 3 weeks, you can start the cyclophosphamide, we're happy with that as long as nothing changes.
okay.
So I started the hormones for the IVF, like the shots and stuff in the hospital. I had like 5 people come up and visit me the first day. They're like, we're gonna take care of all this, no problem. And then I was discharged and continued the injections. And I went home. I actually went back to work the day after I got out.
Oh my
And I was
gosh.
like, okay, well, I'm just doing some like IVF injections. I can do that at work. Um, so I went back to work and for like a week and a half while I finished the stimulation for the IVF. And then they wanted to do my egg retrieval in the OR. So usually it's an office-based procedure, but I was having enough problems with blood pressure that like we really think it'd be safer to do it under general anesthesia.
Mm,
So we did it under general anesthesia in the OR. I don't remember anything. It was super
wow.
easy. Like,
Yeah.
and then after that, I ended up taking a week and a half off
Good.
for there. Had some problems, started the cyclophosphamide, started getting some blood draws, had some really low platelets for a while, which are like a part of your blood.
Mm,
So I was called back in the emergency room a couple of times. I almost got admitted, but fortunately, I did not have to get admitted again for that. And then after about 2 weeks, I was able to go back to work.
wow.
And I just got my first cyclophosphamide dose. So I sort
Okay.
of started therapy for that and finished the egg preservation and was like, okay, it's time to go back to work.
This is February
In
2024.
February,
Okay.
yeah. The way that cyclophosphamide works is it's done in cycles. So the first 3 doses were 2 weeks apart. So I'd go in every 2 weeks. And I would take 3 days off after the injection or the dose day because I would feel really bad. A lot of nausea, but it's a chemo drug. So you feel like your nausea, you're vomiting, you just feel like garbage for
Yeah.
like a
Yeah.
couple of days, and then you like start to feel a little bit better, and I would go back to work in between. After after 3 dose cycles of that, I got spaced out to every 3 weeks, which was much better because I was able to
Hmm.
recover a little bit more in between. And I did that for a total of 6 cycles, I think. 6 cycles, yeah, 6 cycles of cyclophosphamide. And that took me to the beginning of March. I had another episode of weak foot that I was readmitted for and given more steroids in the middle.
Okay.
And then one more episode of rash sort of towards April timeframe that we didn't even wait. They were like, every time you get a rash now, you get like a weak foot or a weak arm or something. So they brought me in. And the plan to get off the cyclophosphamide, which you can't do forever, was to try the rituximab again. And the rituximab is the medication that worked really well for me, but I
Hmm.
had a lot of side effects with the infusion. So like, okay, no problem. We're just going to see how it goes again. Maybe it was the kidney issues from the vasculitis. That's why you were having the reaction to the rituximab. Now that the vasculitis is at least maybe a little bit better controlled and you're on some blood pressure medicines, let's try it again. Because of the reaction I had, they did not want to do it as an outpatient. They wanted to do it as an inpatient. And it actually turns out just because of the way the hospital works, they needed to do it in the ICU. So I was admitted to the ICU for this, which was actually, I thought it was a little bit overkill, but was actually probably the right place to do it because I had the reaction again.
Oh,
We got through the whole dose, half of the dose, which was good. It's given um, 2 days, 2 weeks apart. So I got through the full first day, essentially, not just doing it really, really slow. Allergy helped us out. So I had like allergy, I had critical care and rheumatology, all like co-driving the ship. But I had again sort of just like we were able to push a little bit harder because we're in a place that could deal with it better than an
mhm.
outpatient infusion clinic.
Right.
But just like chest pain. I'm a cardiology fellow, so like I'm pretty well acquainted with chest pain, but
Yeah.
it's it felt like exactly like I tell people it feels like in the textbook. So it was true and true angina, which is what chest pain is from when you have heart pain. And I was like crushing, we call substernal, felt like something was sitting on my chest, just like you read about in the
Oh
books
my
for a heart attack,
gosh.
like
Yeah.
all sweaty and nauseous, and then like a huge headache. And what we think happened was there's a type of heart disease called vasospastic angina, which
Mhm.
is where the blood vessels sort of close up, they just spasm shut, sort of like in Raynaud's, which I also have Raynaud's, where
Oh.
your blood vessels spasm shut in your fingers, they can spasm shut in your heart and also in your brain.
Mhm.
So we think that's probably what happened. Had some EKG changes that would support that. And I don't have any, like I got like all of the cardiac workup afterwards, and otherwise my heart's super healthy. So we think it was causing some spasm in the arteries, probably because the arteries were already unhealthy to begin with, from
Because
the
of the vasculitis.
vasculitis,
Yeah.
exactly. And so that's sort of off the table for now.
Whew.
Fortunately, since getting that, it lasts like 6 months. So we're waiting to see here at the end of September what happens when the rituximab finally leaves my body.
Mhm.
But things have sort of quieted down because things were just not going the way we wanted them to. Rheumatology actually referred me to one of the Vasculitis Center of Excellence, which is going to be like one of those brand name hospitals. You know, you think about like Hopkins or Mayo. So I went to a hospital like that to get their vasculitis expert's opinion. And I get there and she's like, I don't think you have vasculitis. Like, what?
Oh.
Like, come again? What? She's like, it's just not quite right. The presentation's not quite right. The biopsy doesn't look quite right. I don't know what it is, but I don't know that you have that. So I get my pathology samples, which have been frozen from my skin biopsy and stored at the military hospital, shipped to this other like brand name hospital. And the pathologist reviews it and gives a little summary. And he's like, well, it's either this or old vasculitis. And they just didn't catch the vasculitis in time because, like, probably because it healed or had been a couple of weeks since the rash had started when I got it biopsy. So we still don't know what it is. The vasculitis expert was very nice. She said, you know, it's either vasculitis or it's something new. And it's like the sort of disease that only a few people even know what it is.
Mhm.
But you know what? I also showed this brand name hospital review. They gave me a new pathology reading, and I show it to my rheumatologist, and I'm like, here, what do you think of this? She's like, looks like you have vasculitis. And then the vasculitis expert looks at the same report, not even like the slides, but the same report and says, oh, this is not vasculitis. So like, we have
Wow.
no idea what it is. I think probably it's vasculitis because it responded to the vasculitis stuff. But you know, you have an expert saying, I don't think this is it. It could be it, but it could not be it. So I have no idea what it was, what it was at the end of the day. But right now, I haven't had anything in a little bit, so we're just going with it's done for now, and we'll deal with it again. They'll do some more biopsies is the plan if something comes back, and try to get luckier with the pathology this time.
Well, and oh my gosh, there's so many learning points in here, but one thing we had talked about before recording
Mhm.
is ambiguity and uncertainty.
Yeah, yeah.
Seems like you have received from the universe and your health like a master class in experientially experiencing.
Correct. And it's not something that I, as a cardiologist, deal with that I mean, like cardiology is one of my favorites because it's not black and white, but as far as medicine goes, it's like pretty black and white. Like
Yeah.
someone's having a heart attack, you take them, you can see it on the screen, you fix it, and you know it's done. And
Wow.
it's pretty definitive. And a lot of things are kind of like that. And we have unknown. And when you get deeper into anything, there are always shades of gray. But as far as medicine goes, cardiology is like a pretty well defined. We have a lot of money to study it. We've been doing it for a long time. And when I saw this other vasculitis expert, she's like, this is just how rheumatology is. It just lives in shaded gray. She was like, I'm not at all surprised that it's like this. And my rheumatologist said the same thing. She's like, this is just how our practice is. I'm like,
Yeah.
good for you. I didn't do that. But
Yeah.
yeah, shades of gray is it's exactly it, which is frustrating because we went through all this treatment to hear maybe it is not even that at a significant personal cost of maybe sacrifice of fertility and
Oh
um,
my gosh.
all of that. So you know, I don't know. I kind of hope it just is vasculitis because at least we
Yeah.
could have done the right thing. But you know, looking back on it, I think everybody acted in great, like good faith and on the best
Yeah.
information they had at the time, and that's all that you can ask.
Well, and I think sometimes when you have dual diagnoses, they can mask each other or overlap in ways that make them not look like each other, right? Like the
Yeah,
classic
yeah,
case that I see with it as an occupational therapist in rheumatoid arthritis is like someone with hypermobility who also has
hmm
rheumatoid arthritis. And then you got the stiffness from the rheumatoid arthritis and the hypermobility, they mask each
yeah,
other. So you're not stiff enough to really look like you have RA, but you're not hypermobile enough to look like you really have
yes, yeah, yeah,
ABS, but you
yeah.
actually have both. I mean, I don't know if that's the same. I definitely am not a vasculitis expert.
Me
I
either.
have, yeah,
They're
there
always like,
has
"What do you think?" And I was like, "I literally don't know. Just
like,
tell me what you
please,
think."
it's not my heart, so I don't know. Yeah, I
Yeah, it's
did
not
have,
in my box,
yeah.
so I don't know. They did say that it was probably more likely polyarteritis nodosa more than rheumatoid
Mm,
vasculitis. Rheumatoid vasculitis tends to happen in old people who've had really severe arthritis for many, 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 many years. So
mm,
it's a complication that's gone down a lot since the introduction of the biologic medications.
I,
And like I have arthritis and it's bad, but I don't have any like true and true like joint deformities. Like my hands don't look on first inspection like I would have arthritis or something like that.
right, right. Yeah, no, and I was diagnosed with severe rheumatoid arthritis in
Mhm.
2003, but because I've responded to a lot of the meds, a doctor just last summer was like, or last spring was like, you don't have what we call across the room rheumatoid arthritis. Like
Yeah, exactly.
I
Yep.
can't tell
Yep.
from across the room that you have
Yep.
it. But I do want, if anyone's listening wants to hear other stories about people with vasculitis, there are two episodes of the podcast previous to this one, like number 87 with Hay, and then 118 with Rosemary. She had a medication side effect that induced vasculitis.
The
Um,
TNF inhibitors, like your
yes,
Humira and your Enbrel, can also cause them.
that was what it was in her
Yep.
case. Yeah. So just in case some, but it is not one that I like in my experience, see a lot. It's definitely more rare than your straight up rheumatoid
Yeah,
arthritis.
it's not something that I've seen a lot of either. And unfortunately, as a cardiologist, the vasculitis we see is like the really bad one that you get like the really
Yeah.
bad stuff that happened from. So I've had like an recent memory, one patient with vasculitis, and I don't know that he's still. I think he's still alive, but he ended up going for like a heart transplant. Like that's where we were at. So
Yeah. Well,
it can be very severe. Just like anything else is on a spectrum. And when you get cardiology involved in a vasculitis, it tends to be on the more severe side of the spectrum.
like understandably. And what are some ways that you've coped with that uncertainty? Um,
Poorly. I make
yeah,
my
that's
husband
okay.
tell me, so not at all, really. But it just sometimes it feels fake because I am, as a physician, I'm sort of taught to deal in probabilities. So the probability that somebody has a disease like this is already low with the vasculitis. In
Mhm.
terms of the disease that it may be not vasculitis, but something that only a few people know about, it's like doesn't exist, right? That probability doesn't exist. So like, what is really the likelihood that I have that? So it just feels a little fake. I'm like, why are we going through all of this? And my husband's really good at reminding me. He's like, no, like remember you saw this person and this person and this person. It's definitely not fake. And like here are all the like objective evidence, and you can't make up a rash. Like I saw it.
Yeah.
So you're
Well,
not making this up. But
yeah, no, that's really interesting. I think it's such I call it often like a whiplash, like a diagnostic whiplash of like all you want. A lot of people who've shared their stories on this podcast and myself, before I was diagnosed, all I wanted was a clear cut diagnosis.
yeah.
And then you get it, and then there's a tiny bit of a whiplash of like, oh wait, now I have this thing I can wrap my head around. So that's
Mhm.
positive. But the
Yeah.
negative is that I am now have knowledge of specifically what's bad about this.
Exactly. Yeah,
And then,
exactly.
but then you're like, okay, but now I'm adjusting to that. And like in my Room to Thrive support groups, I've seen so many people go, the majority of people continue with the same diagnosis they get. But it is not uncommon for people to then have a change in diagnosis. Like we thought it was ankylosing spondylitis, but now we're thinking it's psoriatic arthritis or rheumatoid arthritis. And they're like, well, wait a minute. I didn't like that I had it, but I had,
Yeah, it was something. At least I had an answer.
yeah.
It's totally discombobulating. I if anybody else has any ideas on how to deal with it, I'm all ears.
Oh, no. I think I wonder, just listening
Yeah,
to how much you've functioned during all this, is that maybe your work potentially being able to focus on something else could be a way of coping.
yeah,
Oh,
absolutely. And I've had the like an incredible like blessing that I've really been privileged in terms of the way that the healthcare system has interacted with me. Um, I don't tend to get gaslit as much, I think, as people because it's harder to do that to a colleague. So I think I do get a VIP treatment when I'm seen. Like I just am.
because you're a
I think
doctor.
because I'm a doctor,
Yeah.
and that is lucky for me. It is unlucky for a lot of other people that they are not getting the same sort of treatment. But I get a lot of people who spend a lot of time with me. At the beginning of all of this, when I wasn't sure what was going on, my blood pressure just kept going up, and my primary care doctor was not really appropriately educated onto that this is not normal. I was because I deal with blood pressure. Oh, that's actually right in my wheelhouse. So I'm like, this is pretty weird. And I had a very good mentor that actually wrote one of my letters of recommendation for medical school, who's a nephrologist, and my parents happened by him. He's a good family friend, and we're telling him what was going on. He was like, I think this is vasculitis.
Mhm.
And he had connections in another very large brand name institution with their rheumatology department and sent my case over to them. And they actually gave me an informal second opinion, sort of in the middle of like when I was still getting diagnosed. We think this is vasculitis. So I've had a lot of support that I don't think most people have in terms of
Yeah.
this is the diagnosis, this is what we're gonna do. Yes, you're getting appropriate treatment. Yes, you're getting all the testing that you need.
Yeah, I think there is this funny saying that I've heard, like that I don't really agree with, that doctors make the worst patients.
They
I've
do,
seen, but
for
I've
sure.
seen that more in like I've seen that in like ortho, like when a doc, like my uncle, I hope it's okay to say my uncle's a doctor, and he did do the classic thing where like he had to get surgery for something, and then like wasn't supposed to put weight on it, and then just did, like that kind of thing. I can see.
Yeah.
But in the case of something like you're dealing with the gray areas, it feels like maybe that's an asset to have that doctor
It
presence.
is a little bit. I always worry that I'm pushing a little bit too hard for something because I
Mm.
think it is that way, and I understand that I'm not the most objective or the best, expert on my own health in terms of like exactly what's going on. In terms of the diagnosis, I think I was lucky in terms of it was a blood pressure issue because I really am very qualified to deal with it. So I knew something was wrong, and I felt very empowered to say, look, you're wrong. And I have a delightful primary care manager. She is not an MD or a DO. So there's a little bit of a power mismatch there. And she's fantastic. But when I went in and said, look, like this is not getting better and this is not an appropriate management, you can't just keep putting medications on. You got to find out why.
Yeah.
And I said, I want a referral to nephrology. And it was, I mean, that was it. Like, she was like,
Yeah.
okay, no problem. And I think probably there's more pushback on most patients on getting specialist referrals.
Yeah. Okay. And I wanted to tie up the end just to make sure that I do, that I don't forget. Sorry, I'm just like, this is how my brain works. I had to write it down on my little sheet here that I take notes on. So in terms of the IVF so
Mhm.
you have gone before you did the chemo, you were able
Yep.
to read, and
Yep.
I know that's a long process. So is it basically that the egg is like available whenever you end up wanting to use it in the future?
Yeah, so we ended up doing embryo preservation because
Okay.
they asked me what do I want to do. I'm like, I don't know. And I'm with my husband who I think is the only person I'm going to have kids with as far as
I
I know.
Mhm.
And I think they're essentially more shelf stable if it's an embryo.
Yes.
So I did, it was like 2 weeks of hormone injections every day, a couple of injections, and then you would go in either every other day or every day for labs in the morning, and then
Mhm.
ultrasounds like a couple of times. Um, and so they would do that for like a week and a half, and they measure and you're measuring your hormones, and they decide they're looking at how many egg follicles they see on the ultrasound. So like they're like, okay, it's like today we see like 10 eggs, and then the next time would be like 15. And they just keep pushing and pushing and pushing until they've decided this magic number in terms of like the hormone levels in the eggs and like how likely are you to have a complication from going too hard.
Mhm.
And they're like, okay, and then you give yourself one last shot called the trigger shot. I think it was like 2 days before we went to the OR. That causes them to all mature at the same time, and then
Okay.
they go in and pluck them out. So and then after that, I was like, okay, I'm like, okay, it's done. Like we got them out, great.
Yeah.
It is not done. I think it's done there if you just freeze eggs. But since we'd opted to do the embryos, they implanted the semen and the sperm and the egg together, and you had to like wait for them. So they actually mature as like a embryo on a petri dish, essentially. And I think this was the worst part. Like I had no idea this was going to happen. Usually there's like a lot of counseling that goes into couples to like what's going to happen, what to
Yeah, that's
expect. We just
right.
didn't get any of it. I mean,
Mhm.
which is nice because we got it there fast. We got fast care, but we just didn't know what to expect. So like every couple of days, we get a call from our REI and the embryologist and be like, okay, these are where you're at. I think we got like 18 eggs harvested, but I think only 5 of them implanted. So
Okay.
all of
Okay.
a sudden we're down to like 5. And then they would call us and see how they're maturing. And at like 2 weeks, they're like, okay, we got the final number. And we had 3, which was a little disappointing from where we were standing, but it is what we got. I think there's a lot of research into how to get the best results from IVF, and they're like, minimize your stress and like exercise and make sure you're healthy. And I was like, not at all healthy. So
Yeah. Yeah.
probably it was because I was very sick that we didn't get a lot of embryos. But that was very stressful to like hear like how many are going in the freezer and all of that, and then they'll stay there in the freezer until we're ready to try to conceive.
Okay. Okay. And there's a book that covers that I've recently finished that I do just want to recommend. It's called Between Two Kingdoms: A Memoir of a Life Interrupted. It's by Sulika Julad, and um, she's was a young person who had cancer and went through a bunch of cancer treatments and wrote a beautiful. She used to have a New York Times column about it, and then definitely covers like, the Between Two Kingdoms is actually about living in that gray area between like the quote unquote kingdom of the well and the kingdom of the sick. Like, and
Mhm.
she had to decide, like at age 20, they actually, her doctors were like, well, you need to start chemo right now, but it's
Yeah,
gonna kill your fertility. And she had to like convince them to let her wait one more
yeah,
month so she could
yeah,
freeze her.
yeah,
So similar covers
yeah,
some of
yeah,
that.
yeah.
So it's just it's a great read as
That's
well.
fantastic. Yeah.
Um, but yeah, that's a lot to have to cope with. I mean, and your wedding and your honeymoon were like you only had like
The preview. Yeah.
yeah, like a year before, or like not months, just months before that. And then you're like all of a sudden having to be like, okay, so we're going
Yeah,
to
yeah,
get
yeah. And we took a year off between the wedding and the honeymoon because it was too much to plan
oh,
both. So we've been
okay.
married for like a year and a half, but
Okay.
I knew like we were planning on having kids after I finished my training. I knew I couldn't do kids and fellowship at the same time.
Yes. Okay.
So it was a little bit sooner than we were expecting to have to
Yeah.
think about all of that. But I'm glad we had the opportunity to, and the team was so fantastic.
Yeah. And then you could theoretically these fertilized eggs could be either implanted into you or into like a gestational carrier,
Correct.
depending on
Yeah.
how your health is
And
going. Yeah.
actually, I should be, as long as I'm in remission, I should be able to carry, and I should be able actually, if we don't have enough eggs or if those don't work out, I should be able to carry another egg. It's not
Hmm.
like the pregnancy machinery. It's the true toxic to the eggs, is what the
Ah,
cytoxan does. So
okay.
we'll see. Hopefully, I stay in remission and I just have a pregnancy, which I think is a lot pretty good for a lot of autoimmune diseases. Is it tends to get better in pregnancy. So
Yes.
we'll see.
The RA for sure, like, I think the numbers are between 60 and 70%.
Yeah.
I was in that category. Like I went into remission during pregnancy. I felt the best I've ever felt since my diagnosis when pregnant, which like
Yes, girl,
especially
that's what I want.
fatigue wise. I'm like
Yeah,
everyone who's pregnant is complaining. I didn't want to be one of those people like, what's wrong with them? It was just
yeah,
for me, I'm like, my lived experience is that I actually have way more energy than I
yeah,
normally do.
yeah,
I felt
yeah.
like, wow, it's like 7 p.m. and I'm not like dragging to keep myself awake for 2 more hours, you know?
Hmm, hmm.
Um, but so I really would hope that. But I would say for the record that lupus is one that maybe people wouldn't be aware of that tends to have more complicated pregnancies.
Yes,
So, but
yep,
what I was told in 2020, and I believe this is still the case, if your RA has been pretty stable, you're not considered a high risk pregnancy just for having RA.
yeah,
I mean, in your case, you have two conditions and yeah,
yeah,
maybe
yep,
more, but just for anyone listening, it might surprise them because I've seen like in my support groups or in like social media, people saying, well, I'm sure I'm just considered automatically high risk and actually, not necessarily. And so but you do need to make sure that your medications are safe for pregnancy and all that.
exactly.
Um, but yeah, I mean, you've definitely, I know you said you answered the question I asked, how have you been coping? You answered it the way that a couple people have actually in the past too, which I think is always a funny answer of like, not well, like, but I think is a very honest answer. Like, that's how a lot of us feel about
Yeah.
ourselves. We're like, everyone else is coping better than me. Like, what
Mhm.
is, but like I guess that's what my negative self, my shoulder negative guy versus
Yeah,
my shoulder
well,
angel, and
angel
then
and
the
devil,
shoulder,
yeah.
yeah, the shoulder devil is like, you're not coping well, but it's like, compared to what? Like, how are you
Yeah,
supposed to cope? This
yeah,
is a lot being thrown at you, you know?
yeah,
So, um, yeah, I think that, I mean, it seems like you're definitely like a problem solver and you're getting, you're control, like working on, like my biggest advice always is like, work on controlling identifying what it is you can control and what you can't control and like learning to just like, and things will shift in and out
absolutely.
of those categories, won't they? Sometimes
Yeah,
there's something
sometimes you can do things like exercise and a stress
Mhm.
management, and that's gonna make all the difference in the world. And like sometimes it doesn't matter at all.
Yeah.
Like you can be stressed or not stressed, like your disease is gonna be horrible. So
Yeah,
don't worry
yeah,
about it too much.
yeah, yeah. Or just like the conditions of your life are just not
Hmm,
allowing for that. You're like, if I'm
hmm.
going to like my best friend's wedding, like I'm not going to like take a nap in the middle of the
Yep,
ceremony. Like
yep,
even if I know that a nap is like the right thing that my body
yep,
needs right now,
yep,
like
yep, yep.
but and one of the things you also, I'm just trying to look at my list here also, before we started recording, you said that you wanted to, one of the things you're passionate about is helping your physician colleagues understand the patient experience that isn't taught in school and that even the most thoughtful physicians might not think about. I thought that was such a insight, like that's such a beautiful phrase. I can't, words are hard. That's
Yeah, as much, I mean, as much as like you try to like think about what somebody might be going through like at the time, like in between appointments or like with the treatment or like how they might be feeling, unless you really live that experience exactly, and nobody can live anybody else's experience exactly, then it's, I think, really important to listen and just do the best you can. I always ask patients, say, look, I'm human. Like, I want to be there for you. Please let me know like what I can do to help you out. Like, And maybe this is me projecting what I want to me onto them, but I say, you never bother. Please don't ever hesitate to reach out to let me know if you have any questions or anything like that. Because often the question that might be really bothering a patient would take me like 5 minutes to address over the phone, and it's no problem at all. But there are certain things like you don't even think about. So I use blood thinners all the time. I'm a cardiologist, like the backbone of cardiovascular medicine. I got Lovenox shots, which are like the blood thinner shots for the first time, and they sting. Like I've done a lot of shots of like Humira and all this stuff, and those guys stung so bad. I had no idea. And nurses always like, "Oh yeah, Lovenox hurts like like crap." And I'm like, I
Whoa.
didn't know. Like I prescribed this 7 times a day, and I had no idea that it really stung. So there are little things like that, like know that your patient's getting waken up at 3:30 in the morning for labs every day while they're in the hospital. Or like that discharge, there's a lot of moving parts to discharge from a hospital, but like the patient doesn't really realize that. And I think like the first time I was admitted, we got discharged at like 8:30 p.m. And it was just like, I was just like pacing. And I had just gotten all these steroids and I was just like pacing back and forth, like I was about to strangle someone. And I know exactly what they were doing. Like they were trying to move it through and probably trying a little bit harder because I'm like a friend of theirs, but like it still wouldn't get done. So, I think it is really hard for doctors to know. And a lot of your doctors are generally younger, healthier people. That's how they're able to get through medical school and residency, and they will not have that experience. So even if they're trying to think about it, it's just something you don't like. I don't think about when I'm on the wards or doing it because I'm thinking about other things.
Yeah, I mean, it's such a tricky thing because like you only have so much time with the patients too.
Yeah.
So
Yep.
you can't possibly think of every possible
Yeah.
aspect of it, but I think you're right to just listening and asking about their actual lived experience and
Yeah. And
what
patients can help out on that other end by sort of like making sure you know what you want to talk about when you come in for an appointment, or if you're in the hospital, like making a list for when the specialist stops by that day, but like having a list so you don't forget. Because it's so easy to forget when you go in, you're like, oh, all these things I want to say. Symptom tracking is great so that we know, like, I'm giving you this medication, it has a side effect. Did you actually have it? Like, when did it start? How bad is it? Like, what is it impacting? Otherwise, I won't know. Like, if I'm your doctor and like nobody's keeping track of it, then I'm like, all right, sounds good. Everything's working good.
yeah.
Congratulations.
Yeah, and a lot of people tell me in the rheumatology or chronic illness world that they're nervous about bringing their symptom tracking journal or system to their doctor because they're worried the doctor is going to quote unquote like gaslight them or say well, you're just, and I was told this once, the very first time I ever brought my symptom tracking, this is like a couple months prior to my RA diagnosis, the doctor, and this was like a concierge doctor that
Yeah.
was like meant to be helping me determine what was going on. She eventually did lead me to my RA diagnosis, but she's said that, what do you think it means that you made this list? So I'm like, okay, who made you this? Who died and made you the psychiatrist? But okay, but
Yeah.
anyway, she's a good person. She genuinely thought the best of her knowledge was that I was just a hypochondriac that was overly
Yeah.
stressed about everything. And that, yes, at that point, actually, I had a definitive diagnosis of gastroparesis. So at least there was something definitively wrong in my body, but it was like something else
Is wrong. Yeah.
very off. But my symptoms that I was tracking were like related to my GI and like
Yeah.
system
Yeah.
just off. I'm trying to figure out what I can and can't eat. And just like, what do you think this means that you made this tracking? I'm like, it means that I feel shitty and I want to feel better. And like, I'm going to the doctor to feel better. But she's like, I think you need to like step away from the list making and
Yeah.
and that's just it. I think we just have to acknowledge that some doctors will just say that. And
Yeah. And the other thing that I do is I don't necessarily bring the list with me. It's something that I review in the like in the waiting room before I go in. So like I use Guava to track, which is amazing. I super love it. But like makes me a little PDF of all my stuff, and then I can say, okay, like in general, these are the things that are bothering me, and this is when it started. And I don't like I mean, you can print out a PDF and things. I generally don't because I find it gets in the way of like an organic conversation. But it just helps me sort of remind myself, okay, was I actually feeling bad? Was I not feeling bad? 'Cause sometimes I forget if I'm feeling well the day I go in. I'm like, yeah, great, everything's good. And my husband
Yeah.
be like, what are you talking
I
about?
hate that. I always feel better the day that I'm in the
Yep.
office. I'm like, what
Mhm.
is up with that? Except there's been a couple of times my rheumatologist has been like, like she has to call me out, but this is just because we've had a relationship now for like 20 years that I really minimize my symptoms sometimes because I'm like, I just so badly want to be feeling good. I'm
Yeah.
like, oh, it's probably just this. It's probably that I just, like we went to Japan this summer. It's probably just that I went to Japan and maybe my joints are still stiff from the airplane. She's like, well, that was 7 days ago. So, you know,
Maybe not.
you got back from Japan 7 days ago, so maybe we just, yeah. So you kind of have to know yourself and know your own. Like, I actually, ironically, I'm like, yeah, I'm accused of being a hypochondriac. I actually tend to be objectively more of a minimizer. I actually tend to minimize what I'm going through, and that's not good. Just FYI for the record, for anyone listening, for in rheumatoid arthritis, the analogy my doctor used years ago that really stuck with me is, you don't want to minimize your symptoms to your doctor because it's like a fire. The inflammation from rheumatoid arthritis is like a fire. So you want to catch it when it's really small, and it's much harder to catch. Like you want to catch it when one room is on fire, not the whole house. And so the longer you wait, in my case, it was when it's always been when one medication is not working anymore. You don't want to keep staying on it for too long and letting that inflammation. I know you're nodding because but I'm just for people listening because I think it's if you don't know that, you might say, well, let's just since there's only so many meds out there, maybe we'll squeeze all the time out of this med that we
Yep.
can. You don't realize that there's a risk to that. Um, Sorry, let's feel like I'm taking over your story, but anyway, I those tips are really helpful for sure. Being organized. I always just do it on my notes app. Like I make a list of what I want to talk about on my notes app, so it's on my phone, easy to keep track of.
Yep.
But you mentioned Guava, which is a symptom tracking app, and it is very helpful. I'm going to put a link to that in the show notes. And if you're listening to this on audio, by the way, like if you're listening on your podcast platform, you should definitely look up the video version because Elena has a beautiful cat that was in the
Oh
back.
yeah,
Yeah,
she's over there now. She's off screen.
yeah, she was just curled up really cutely for a lot of the interview. But is there anything else you wanted to cover before we go to the rapid fire questions?
I don't think so. I think we
Okay.
got a lot of
We
it. It's
covered
just
a
there's so
lot.
much. We've covered a lot.
No,
Yeah.
we did. We did. I always ask that because, yeah, sometimes when I'm in an interview, I'm like, oh, I really wanted to make that point I forgot to make. But if you think of it later, that's okay too.
Sounds good.
Yeah. What are your best words of wisdom for a newly diagnosed patient?
Loosen up your shoe budget. So like I like oh I'm like kind of cheap on certain things and
Thrifty.
I haven't been doing it this year because I'm like we've had enough going on. I don't need to worry about saving money too. But I'm a fan of watching my finances and I got diagnosed and I just went through a bunch of shoes and I was like, I just bought a pair of shoes and they weren't the right shoes. And I would like try to stick with them and they weren't out right. And I went through a lot of shoes. So if you're newly diagnosed, be okay with like buying a lot of new shoes. Like it's okay. It won't last forever. You'll find the ones you want and you can keep buying those.
Do you have a favorite brand?
So in the hospital, I've got these new ones. They're called Cloves, that are like wipeable sneakers, and they're pretty good. I like those. I like my Dance Goes, because
Yeah.
they're real hard. And
Mhm.
when I'm wearing lead, they're much more supportive. I don't have as much like hip or like knee pain afterwards, but they're not like cushy. They're like real hard. They just have aggressive foot support. They're not good for running around. You tend to turn your ankles in them. So
Yeah.
I'll wear those in the lab and then I like Hoka sneakers too, but they're not wipeable. So I get like weird
Mhm.
stuff on them. I spilled a smoothie on it once, so it looks like it's blood, but it's really like blueberries. But then
Oh,
there's like
no.
blood on it too. They're just like kind of gross after a while. So I
Wait.
wear those and then at home, and then sometimes in the hospital I'll wear Birkenstocks as well. But then at home in Texas, certainly I'm like Birkenstock sandals like 100% of the time.
Yeah, we have the same exact taste. I literally all my shoes are Dansko, Hoka's, or Birkenstock, or like Mephistos that are like similar to Birkenstocks. And so true.
Mhm.
I have Danskos I've had for like 10 years, so they are really helpful.
Oh
And
yeah, I got mine in graduate school. I've only had one
yeah,
pair.
Well, and
But
I
now
don't.
my foot's changed just enough that they cut off the circulation on the top, so I'm gonna have to get a new pair.
Yeah, yeah. And they do typically I have almost never had pain in my left foot, but I'll get pain on the ball of my right foot, kind of like with rheumatoid arthritis, you usually get pain in like the knuckle joints. That's kind of like the equivalent of the knuckles in the
Yep,
foot can get
yep.
inflamed. And the dance goes, I was talking about this with the podiatrist. What's really nice is they take
And
they make you stand more on your heels than the ball of your
mhm,
foot. So you're
mhm.
alleviating that pressure
Yeah, and
from.
that like the MCPs are like the ones that are a lot of time on steroids are always inflamed. So like the dance goes are like my dream shoe. I
They're
love them.
so good. But you're right that if you're kind of trying to run in them, you could definitely twist your ankle. Do you have a favorite arthritis gadget or tool in your toolbox?
I do. So I'm a exceptionally fast typist, and I was really hard to let go of this. But as sort of when I was in fellowship and writing more and more, and my joints just became worse, I transitioned to dictation, and it's been like a complete game changer because even when like my fingers are not inflamed, they still get more tired than they used to, and I cannot type as fast. And I was worried that I wouldn't be able to speak as fast as I type. But with a little bit of practice, you can, and you're not using any of your joints. So I just have like this little like like dragon dictaphone, and I like talk
Mhm.
into it, and it's amazing. So I
Right.
do that sometimes with like text to speech on my phone too, if I'm having like a bad hand day. But for work, the dictation is huge.
Yeah, I feel to me like it's almost the standard of a lot of doctors now are using it because it's just
Yeah.
so fast. Or they have a scribe.
Well, that's nice.
Yeah,
They
I'm
don't
like,
give
it's
fellow scribe, and they certainly don't give military fellow
well, let me tell
scribes.
you who gets the scribes, the fancy dermatology.
Yeah, yeah,
I have
yeah.
a wonderful dermatologist who's not, she's totally down to earth but she
Uh-huh.
works at like a fancy dermatology clinic. So I'm like, oh my gosh, this is so over the top whenever I go there. I'm like, okay, anyway, sorry. But yeah, they have a scribe to help. Yeah. Um, the gastroenterologist had a scribe once too, actually. Do you have a favorite book or movie or show you've been watching recently?
So we are horrible TV people. We like to put one season on or one show on forever. Recently made it through the entirety of Law and Order SVU.
Oh, that's great.
Wait, you just don't have to think about it, right? You're just like, all right, the next episode for like 25 seasons or something. And
No,
I can
you
like
like what you
scroll
like.
TikTok and do
Yeah.
whatever, like a low brow.
It's
Uh,
no, not at all. Look, there's no such thing as a guilty pleasure. People like what they like, and it's not hurting anyone to like
yeah.
Law and
But in
Order.
terms of books, probably my favorite book is a book called In Shock by Rana Ardwish, I think is the name of the author. But
Okay.
it's a fabulous read, and it's sort of what made me want to start posting my story. She is a critical care physician who, during the birth of her child, had HELP syndrome, which is like the
Okay.
hypertension or something like that. She ended up and long story short, ended up in her own ICU, like ventilated on dialysis, and she talks about the experience of being in that situation and like sort of the things we do in an ICU. So like we'll do things like a daily awakening trial where a patient who's intubated on sedation, you take away all the sedation and you see if they wake up to just like see what happens. And she's like, this was the most terrifying part because you don't know what's going on. You're like tied down, you've got something in your throat, and all of a sudden you're like awake, and then like they like plunge you, so like they plunge you back into darkness and they like resedate you, and it's like every day. And so just like hearing about that, and then she'll talk about how like providers like we use a lot of slang. So, like, oh, this one's like tried to die on me last night. And she's like, well, I didn't really try to die on you last night. Like, that's kind of rude. And sort of like watch what you're saying and sort of, again, that perspective that you may not otherwise have. And I read it in a day. Like, it was so good.
Ah, wow. Okay. It's called In Shock.
In
Okay.
shock. Yep.
That is so true. As someone with claustrophobia, which is fear of being trapped, like that's literally what you just described as like my nightmare of like being held down and like not being able to move and being conscious is just like ah. But
Yeah.
so and yeah, the overall point is very well taken that like you have to consider the patient lived
Consider them. I
experience.
mean, we don't think about it, right? They're like, all right, sedation trial's done. Time to go back
Yeah.
under sedation. So
Gosh. Well, it's like they're knowing or figuring out now that like a lot of people that they thought were in like comas were actually like conscious and yeah,
yep.
it's just
Yep.
Yeah, I definitely would check that one out. Do you have a favorite mantra or inspirational saying?
Yeah, I had a little meme this year. I don't know if you've seen it going around, but there's like this little hamster and she's got like star glasses or something, and she's like driving like a purple car or something. And she's
Okay,
like,
I know
the
I need.
horrors persist, but so do I. And like people that ask me how it's doing, I'm like, well, we're hanging in there.
Oh my
It's
gosh, wait, I need
amazing.
to like add that as the episode artwork for this episode.
Yeah. I'll send it to you because I've like bookmarked it and I like printed it out and put it on my desk.
Oh,
The horrors persist, but so do I.
I
Uh,
love it.
And then the one that sort of got me through a lot of things, I did like mountain warfare training with some of the Marines and
Oh,
like the bigger stuff. You're like, you can do anything for X number of time. And it doesn't really matter how much long it is. So like if I'm on a tough rotation, I'm like, you can do anything for 2 weeks, right? Like it's just 2 weeks, or like anything for a day or anything for 3 minutes or whatever. It's just like all pain passes
for
eventually.
10
All
seconds.
bleeding stops.
That's like me getting like having to get an MRI, or I'm like I can do anything for 10 seconds. Like I just
Yep,
10
yep,
seconds to 10
yep,
seconds to 10.
yep.
Yeah. I love that. I love that. Oh, and this is the big one. This is the question. This next question is like the question that this podcast is literally like trying to answer, like implicitly. But to make it explicit, like what does it mean to you to live a good life and thrive slash attempt to thrive with rheumatic disease?
I think it means to be able to do the things that are most important to me. Maybe not everything that I want to do, but the things that really are most important to me. So showing up for my family, showing up at work, showing up for my health in a way that's not horribly interfered with by symptoms. So, like I can tolerate some pain, but if I am in too much pain to do my job or my fingers aren't working well enough to do my job, that's not living well. But if I'm at a little bit of discomfort, that's okay. As long as I can show up and do what I need to do and do what's important to me within reason, then I think we're doing pretty well.
I love that. That's really similar to how I look at it as well. Like maybe not necessarily, I mean, yes, in a perfect world, the symptoms would all go away, but a lot of the times the best we can do is just not be completely interfered with, you
Yep.
know. So
Yep.
I think that's a very well taken point. And you mentioned earlier that you started to share your story online more.
I
Where
have.
can people find
Yep.
you?
On Instagram mostly, or actually exclusively, because I like can't post on TikTok. I don't know how to do it. uh,
Oh, I can
but
teach you.
my handle is the dancing physiologist, and it's really sort of still a personal account. I leave it open, and I do write about a lot of stuff. I think now that things, on knock on wood, have sort of calmed down a little bit, I'm writing a little bit less, but I do have like a notes app for future posts. But you'll see me like hanging out with my best friend, but also I do try to write some posts on sort of my experience and what I've learned from that and what I take for that going forward.
Yeah, I really have to say, I think you're a really good writer. I mean, I mean, if you ever end up taking some of your posts and turning them into a blog or something like that, I think it would be amazing. Not to give you one more thing on your plate, which is very full. But yeah, that's wonderful. Well, thank you so much for taking the time to share your story. I mean,
It's so much fun. Thank you for having me.
oh, and I know you said before that you're a listener of the podcast, which is it's fun to have someone who
Mhm.
is like a podcast enthusiast attend. And I hope that it was I always say that, I'm very enthusiastic about sharing my story, but I often underestimate the emotional labor that it can kind of take. It can be tiring and emotional to go through all these, details and realizing what you've gone through. So thank you for taking that, doing that
Absolutely.
emotional
My
labor.
pleasure.
Yeah, Teddy can tell hold on a second. Um, they say like, yeah, the dogs
Oh,
can kind of, there's Teddy, my dog. So if you, this is their teaser to listen to the YouTube or to watch on the YouTube channel.
uh-huh.
Or you
Yeah.
can also see a link to the
Oh,
video on my podcast.
can you say hi?
Yeah, yeah.
Oh,
Teddy can tell when I'm starting to, it's like dogs get to know like your winding down voice. Oh my gosh, your kitty lets you hold her.
yeah, she's gonna scream here. Oh, she's about to punch me. All right. All right.
She she's like, okay, I've
Stop.
tolerated you
I'm
for long.
done.
Yeah, yeah. Oh my gosh. Teddy's like, can I just meld into your face? Because he's a Cavalier King Charles. So yeah.
Yeah.
Well, thank you so much. I'll
Thanks
let
so
you go
much.
get rest, much needed rest, but
Yeah.
we will talk later. Bye bye for
Sounds
now.
good. Have a great evening. Bye bye.
You too. Bye.